Here's the place where you will find alternative ways to make you stronger and healthier. Here's the melting pot where acupuncture, functional medicine, biomedicine, herbology, and nutrition are well integrated. Welcome to Acupuncture and Above. Everyone, how are you? This is Acupuncture and Above, hosted by HH Natural Medicine. I'm Dr. Li Shu. January is the month of Glaucoma Awareness Month. In last episode, I gave a general introduction of what glaucoma is, the causes, in a brief summary. Since glaucoma can cause irreversible blindness and there's no cure for it yet, the key is early detection and prevention. So if you are in the high-risk group, i.e., if you are 60 years and older, or have a family history of glaucoma, or have diabetes, or if you're African American and you're 40 years old and above, you are highly recommended to have a regular visit with your ophthalmologist to check your eyes. If your eye doctor finds out that you are glaucoma suspect, even though your eye pressure is within normal range or higher than normal, before it gets too severe, I recommend you talk with your eye doctor about alternative care. Based on our experience in the past and many medical publications, early intervention of acupuncture treatments can help you reducing eye pressure and improve circulation of eyes and prevent glaucoma and vision loss. I'm very grateful that I have 2 patients willing to share their stories with us about their journey of using acupuncture to help them reduce eye pressure and improve vision health. The first story comes from the patient that we had since April of 2022. Initially, she visited us in order to receive treatment because she had back pain, knee pain, shoulder pain, etc. Later, she started receiving treatment of acupuncture to reduce eye pressure due to early detection of glaucoma. Here is our conversation over the phone, and to protect patients' privacy, I hide her name.
Hello.
Hey,
Hi.
thank you very much for sharing your story with my audience.
Yes. Well, I was diagnosed with intraocular hypertension. Normal eye pressures are below 21, and mine in the first visit in March that I went to had risen up to 28.
Okay.
And on both eyes, and my optic nerves were healthy. She said the pressures are high. When they become high, they become concerned about glaucoma. So I have a family history of glaucoma with my mother. So I asked the doctor if I could. I told her that I was receiving acupuncture for knees, shoulder, arthritis, and kidneys, and I asked her if we could wait for 3 months and see what acupuncture would do for my eye pressures.
Oh, so what was the doctor's intentionally wanted to do?
Give me a topical medicine for my eyes. Eye drops, yes.
Yeah, okay, got it.
And she was more than happy to let me see what the acupuncture could do. So when I did a follow-up treatment 3 months later in July, the pressures had gone down to 24. She thought the one eye she thought was essentially looked almost within normal limits, but the other eye was 24. And she stated that it would be okay at that point to wait until 6 months before she did a follow-up treatment.
Okay.
And she was actually happy with the results.
Okay.
Because I had done nothing else to change the pressures. I'm taking, in addition to receiving the acupuncture, I'm taking herbs for the glaucoma as well.
Yeah. Oh,
and
okay.
I was neglectful of my eyes, but prior to that time, I had no problems that were apparent. And so the important thing to know is that there are often no symptoms with eye pressure.
That's right.
You know?
Yes.
So people need to have their eyes checked because they wouldn't know sometimes until it's too late.
Absolutely.
You know?
Absolutely. You are very correct. And that's the goal of my podcast or the YouTube. Just like have a public education, because January is the month of glaucoma awareness.
Oh, okay. Yes.
Yeah. So I wanted
good.
to just let everybody know, especially people over age of 60, to have a regular checkup.
Yes. Then, and I certainly should have kept on top of it a little better than I did.
Well, you did well. But anyway, I think this is very helpful. I really appreciate share your story with my audience.
My pleasure. It's my pleasure.
That is true. Acupuncture demonstrates the ability to benefit patients with glaucoma. Modern research has determined that acupuncture benefits blood flow in the arteries of the brain and eyes. The results are confirmed with ocular blood flow, flowmeter readings for ocular pulse amplitude. Several studies show that acupuncture can modulate intraocular pressure and improve activity of central visual acuity. Researchers at the Department of Ophthalmology at the University Hospital in Germany investigated the short-term effects of acupuncture on different ocular blood flow parameters and found that acupuncture based on eye-specific protocols had reproducible and quantifiable effects on ocular blood flow in patients with primary open-angle glaucoma. Another study of patients treated for glaucoma showed reduced intraocular pressure, both 1 hour after the treatment and more generally after having completed 4 treatment sessions. So the first story would be a great example of how acupuncture successfully helped this patient reducing intraocular pressure. Her treatment is still ongoing, and I may find a chance to report the progress about her follow-up visit with her eye doctor. The second story is a patient who receives acupuncture treatment from both me and Dr. Shao for many years for different health concerns. About 10 years ago, she started receiving acupuncture for her glaucoma, and since then, she uses acupuncture to maintain her vision health till today. Luckily, she was in clinic for treatment the day that I prepared this episode, so I'm very thankful that I had an in-person interview with her at the clinic. Here's our conversation.
Hi, Dr. Li Xu.
You tell me about the history of your glaucoma.
Okay, my eye doctor told me I'm a glaucoma suspect about 10 years ago. My sister and my cousin recently was told they were also glaucoma suspects.
Did you have a higher eye pressure?
I don't remember the number, but he did tell me that my nerve on my left eye is a little bit thicker. I guess my pressure was a little bit higher, so he put me on eye drop medication. That's 10 years ago. And I also started the acupuncture treatment. And then 2 months later, my eye pressure was normal. But my original doctor had retired. I had a new eye doctor, and I told the new eye doctor I felt I have a side effect, dry eye from the eye drop. My doctor, he was more progressive, and he said he has a lot of patients who uses acupuncture. So he told me it's okay, let's stop the eye drops and just do the acupuncture. So I did stop the eye drop, and I only using acupuncture.
The only treatment for glaucoma maintenance is acupuncture?
Yes, I have arthritis and sometimes digestion. So on and off, last 10 years, I've been getting acupuncture treatment. And I believe that's helping me, my eye pressure.
So what was the latest eye doctor appointment and what was the result?
I was getting eye exams almost every year, and every year ever since it's been normal. And the latest one was beginning of December
of 2022,
this year, not too long ago. And I was told that my eye pressure is normal And when I told this doctor I'm a glaucoma suspect, she was surprised and she said she doesn't see any sign of it.
Oh, wonderful.
So I'm very happy.
Thank you very much for sharing this with my audience.
You're so welcome.
Well, at the end of this episode, I would like to say that acupuncture treatment is a personalized treatment plan for eye diseases. Besides the specific acupuncture points for vision, the rest of the points may vary and be different depending on the person's health condition. In order to reach the optimal results, personalized treatment plan is the key and ultimate solution. I might use different acupuncture points for different patients, depending on the diagnosis and the findings of the root cause. We treat a person holistically, not pieces of tissues or organs. So if you ask me what points did I use on these patients for glaucoma prevention, it will be hard to tell you. If you appear to be an acupuncturist who is listening to my show, what I can share with you is, number one, acupuncture is proved to be effective for vision care, including glaucoma. Number two, there are some eye-specific points you can use, but most importantly, working on the diagnosis and the root condition of the patient. Number three, acupuncture is also very effective on vision maintenance as well. If we make correct diagnosis and use proper techniques, acupuncture is not limited to help glaucoma only. It can be applied to many other eye diseases. I wish my podcast may send hope to people who need eye care and send encouragement to acupuncture practitioners as well. Well, in next episode, I will share how to use food and herbs to take care of eye diseases, including glaucoma. I will share a special herbal tea to help glaucoma and eye pressure. Stay tuned. I'll see you next time.